Hello, hi guys, welcome back. Sorry, I was quite busy. I couldn't post for I think maybe for 2 days. Excuse me. Okay, so I was quite busy the previous 2 days. I think. Okay, so I don't want to waste much time. I'll get straight into the point. Okay, I think. Yes, I think we did this starting of. We did estimating skills. We also finished starting a station. Oh, yes, okay. So we finished this introduction part. Today we'll just talk about the flow of the consultation. So it's not exactly the flow of consultation, but today I'm just focusing about the history taking performer. So in the history taking, so these are the very basic things that you should learn during giving your PLAB exam. So today we'll be talking about just the history taking. So what is the history taking basic format? So it is a basic format for taking history. What does it consist? And the go-to formula is P3 Maftosa. We can also say as P Maftosa, but the P is 3 times. So P3 Maftosa. First P, it first P stands for presenting complaint. I'll talk about Socrates at Para in the yes, I'll talk about it later. So the first P is presenting complaint. Second P is past medical history. The third one is personal history, and remaining is Maftosa. M. Medication history, allergy history E, family history F, T. Travel history, O. Occupational history, social history, anything else you would like to tell me. So this is the, you know, in the previous video I talked about the ICE protocol, the expectation part. So you can use at the very last of your consultation. Anything else you'd like to tell me, or or as I suggested, at the very last when you finish your consultation, you can say, okay, so mm, was there anything, uh, was there anything that you expected different from what we have discussed today? So you can use this kind of sentence. So were you expecting anything different from what we have discussed today? So this is a simple word or sentence you can use at the last to deal with that expectation part of the ICE protocol. I think you guys, if you have watched my previous videos, you might know about the ICE: ideas, concern, and expectation. Okay, so um, without further ado, so I'm just going to talk about the first P, is presenting complaint. Okay, so in the presenting complaint, there can always be two things. The first is pain, any kind of pain like headache, stomach ache, leg pain, like back pain, anything with the pain. Okay, and the rest of the things would be other symptoms like dizziness, tinnitus, or lump, swelling, anything like that. So one would be pain, and the other symptoms would be except for the pain. So it becomes very easy. For the pain, we are going to use the acronyms, these mnemonics: Socrates, Socrates, and for other symptoms apart from the pain, we are going to use F Odipara. F Odipara. Okay. So what does the Socrates for the pain stands? S. Site. O. Onset. C. Character. R. Radiation. A. Associated symptoms. T. Timing. E. Exacerbating factors. R. Relieving factors. So one would be exacerbating, other would be relieving, and S would be severity of the score. Okay, so just on my personal experience, so rather than keeping the severity score at the last, what I used to do was I would always use this at the beginning, you know, at the very beginning of the pain, like presenting complaint of the pain. So you have to be you have to be a little bit clever about this kind of scenario, you know. if you enter the cubicle and the pain is, the patient is like, this patient is having an excruciating pain. He's just closing his eyes, he's holding his head, like, even from the, in the GMC, the actors would be very, like, they will be very accurate. Like, they will show the emotion, expression, everything will be like of a typical patient. So by, if you see such kind of patient, like, if you feel by the first stance the pain is very severe, I would suggest you to, like, ask this severity at the beginning. What I used to do was like, okay, I can see you're quite bit of, like, in a pain. Like, can you quickly can you quickly, like, score the pain on on a scale of 0 to 10, 0 being no pain and 10 being the worst pain? Can you tell me how worse is your pain? In the patient, so, yeah, doctor, it is 10 or it is 9 or it is 8. Then at that point, what I used to do was, okay, so I can see that the pain is quite high in the score. Do you like me to give you some analgesics or some medicine so that we can carry out the consultation in a more smooth way? And there can be two responses. Yes, doctor, just give me something to help me. And you can look at the examiner or and say that, okay, I'd like to prescribe some paracetamol. Okay, so not the higher grade of, avoid using flexons, avoid using NSAIDs, okay? Avoid using other, like opioids or something like that, because this medication might have some serious side effects. So the first painkiller, paracetamol, is the, like, go-to medication. It rarely has any side effects. So what I used to do was, I would, like, look at the examiner and say, okay, I would like to give my patient a single tablet of paracetamol so that I can carry out the consultation better. If the patient agrees for that, but believe me, most of the time the patient will say, no doctor, it's fine, you can carry on. Okay, so by doing this simple trick, by accessing the patient first. If he's in very much severe pain, you're just going to ask the severity score at the very beginning. I can see you're in a great pain, or I can see that you are very disturbed, or I can see that you are having a terrible headache or terrible pain. Can you quickly score how bad is your pain on the scale of 0 to 10? And you have to say that what the 0 stands and what the 10 stands. 0 being, 0 being no pain, and 10 being the, like, worst pain. How would you score your pain? And the patient will say accordingly. I think you guys got my point, right? Okay. Apart from that, now the simple trick is, just, if the patient is having, just the patient looks normal and is not in a great pain, then just go along go along with the flow. Okay, patient will say, I have pain in here, I have pain in there, or you'll just say that I have a headache. So, or you say, I'm experiencing quite a bit of pain, and you can just say, okay, according to the formula, you are going to say about the site, and you are going to ask, okay, so can you tell me where is the pain? Can you show me with one finger? If this is generally used, in, when the patient complains of vague abdominal pain. This will, in the pain of appendicitis, patient typically points to the right iliac fossa down, right? So yes, this kind of question you can ask. And also remember, in my previous video, I told you guys, right? You are not going to directly ask, okay, where is the pain? How did it start? One by one. Always start with the open question. Patient will say, okay, I'm having this headache. I'm having this abdominal pain. Open question first. Can you tell me more about this pain? And the patient will say, okay, I have the pain in here. It is getting worse since 2 days. Um, it started suddenly, something like that. And like you have to be doing active listening. Okay, so whatever the patient says, you are going in the mind, you are going to tally. Okay, he talked about the pain. He said he has pain in his upper abdomen. Okay, he talked about the onset. He said that it started suddenly. He also talk about the, when did it start, like 4 days back or 2 days back. So you have to tell it that. And so what is missing? So, and after that, after he completes his answer, to your open-ended question, like, can you tell me more about the pain? And whatever the things are remaining, now you are going to ask, okay, so can you remember what type of pain it is? Was it dull, or what is like compressing or sharp pain? And you'll say yes, it was a dull pain, something like that. And can you tell me that did the pain move anywhere else, or just stayed in the site you mentioned? And you say no, yes, it was radiating to this side, it was moving down my leg, something like that. Okay, so this is very important. Mm. So okay, so I'll just go with the flow now. Okay, so sight. What is the pain? Can you show me with one finger? When you are asking about the onset, so how did it start? Passenger will say it started suddenly, or he might say it occurred gradually. It is getting worse day by day. And about the character. So what type of pain is it? Is it? You can ask leading question. Was it dull? Was it ache? Was it compressing? Or was it sharp pain? Yeah, okay. About radiation. Does the pain go or move anywhere else? Okay. So associated symptoms. So along with the pain, did you experience any other symptoms? Like, and you say, yes, I also had this nausea, like hours of vomiting. You also have some diarrhea. You also have some fever, something like that. You'll just talk about it, okay? And timing. Okay, so about the timing, you can use this word like, is there any specific time you experience the pain? Or you can say, or you can simply say, okay, can you tell me at what time of the day is it the pain gets worse? Or you can say, is it always there, or does it come and go? Like something like that about the time. Okay, these are the questions you can ask. So it could be on and off pain, like in the ureteric colic pain. Okay, so renal colic pain, it can happen like that. So any specific time, like the nighttime pain or nighttime shortness of breath, something like that. Okay, nighttime chest pain, something like that. Yeah. So exacerbating and relieving factors. So these are very important things. Like, is there anything that makes the pain worse? For the exacerbating factors, yes, doctor. Like whenever I bend my head forward, the headache gets more worse. The differential diagnosis for sinusitis, or like the idiopathic intercalated pressure headaches, something like that. So relieving factors. Is there anything that makes the pain better? Like leaning forward improves the abdominal pain, in pancreatitis, something like that. So severity score. I already talked about this. Okay, based on the scenario, based on the actors who perform in the GMC, you can decide whether you are going to ask severity of the score at the first or beginning. What I used to do was I used to look at the cases, and if I feel that patient is having quite a bit of a pain, then I directly used to ask at the beginning. Yeah. So just to be in the safe side, I used to get. I think the examiner will mark you good if you do that, because you are also seeing the patient like at first only at first of beginning of the session you are evaluating your patient like he's having too much of pain, whether he's able to answer your this 10-minute consultation. So you have to think everything like a real patient. Okay, even in the real OPD, if patient is having this kind of severe pain, it is very difficult for the patient to talk to you and like give you the history very calmly. So yes, so these are the things you should take care of while asking about this present complaint. Okay, history of the present illness. Okay, so next, FOD para. So this is for the uh, mm, this is for the symptoms rather than the other than the pain itself. Anything, lump, swelling, anything except for the pain. Okay. So F stands for frequency. So how often does this come? Like the swelling. How often? Like dizziness. Like how often is your dizziness? How often does it come? Something like that. But again I have to tell you, because you guys will forget, and even I used to forget. First would be always open question. Can you tell me more about your disease? Can you tell me more about this lump? Let the patient speak first. Like whatever he says, tally it according to the FOD para. Whatever he says, he talked about the onset, just at the mind, tick it, and duration. Okay, tick that also. So what is missing? Progression. He didn't talk about the progression. He didn't talk about the relieving factors. Does swelling goes on itself or not, or anything that makes it worse, something like that. Okay. Okay. Let's talk about the frequency. I will talk about the frequency. Onset. How did it start? suddenly or gradually? Same like the Socrates. Duration. When did it start? How long have you had these symptoms for? Okay, progression. Is it becoming worse, improving, or is it the same? Swelling, first the small will be pea size, gradually increasing to the lemon size, something like that. Okay, aggravating factors. Anything which makes it worse or anything which brings it on. Whether it is on and off pain, like the on. Sorry, this is not the pain. Whether it's an on and off swelling, or the hernia. Whenever you cough, it gets buzzed out. So that is aggravating factor. Relieving factor, anything which makes it better. When you lie down, hernia gets reduced. So yeah, relieving factor, something like that. Swelling gets disappear, something like that. Association symptoms. Okay, along with the swelling, do you experience any other symptoms? Yes, along with this, and patient might say, yes, along with the swelling, I also have this pain, or also have this rashes overlying the lung, something like that. I don't know, anything maybe like fever, headache, vomiting, something like that. Okay, the first piece done. Second is past medical history. So this is, I don't think this is new. You're just going to ask about the past medical histories. Do you have any medical conditions that I should be aware of? Have you ever been admitted to the hospital for any reason? Previous history of hospitalization. Okay, so have you ever had any operations performed on you? Very important questions based on the cases. Okay, so guys, whatever I'm saying, these are just the format. Okay, we are not going to ask everything because you not have time for this. Based on the cases, based on what might be the cases, you are going to ask. If this operation is still relevant, you are going to ask, but you are not going to miss. The most important thing would be forgetting is to like forget about asking medical condition. In every case, you are going to ask, do you have any medical conditions that I should be aware of? Hypertension, diabetes, something like that. Okay. Okay, so it is here, right? Do you have any medical conditions like asthma, high blood sugar, high blood pressure, heart problems, epilepsy, stroke, something like that? And these are very case basis. Have you ever had any operations performed on you? So is it good to ask? But I don't think if you ask every question, you can manage the time. Okay, so do not forget about the medical conditions. Other things are just based on the cases. Okay, so personal history. Okay, so I don't know you guys are confused or not, but when I used to give my exam, I always used to think like personal history is smoking, alcohol, something like that. It is not, okay. Smoking, alcohol, these things comes under the social history. So, uh, and in my previous video, I have mentioned this. Okay, you are not going to ask directly personal history. Sign posting is very very important. While you signpost, you are not going to ask permission. You are just going to signpost. Okay, now let's talk about your sexual history. Okay, so let's talk about your personal history. I need to ask you a few personal questions. If you find it a little bit of too much, please let me know. I will stop. Okay, you are not going to ask permission. You are just going to say, okay, I need to ask you a few personal questions. Worst case scenario. What if person say, no, this is my personal thing. I will not answer it. Or this is my personal thing. Why you have to ask it? You are just going to explain them. Okay, I'm sorry you feel that way. I'm sorry you feel offended, but these are the general questions we ask to all of our patients to get a better idea of what is happening to the patient. So you are just going to use those phrases, and obviously after that person will obviously say, okay, go ahead, and will give you history. Okay, so signpost. Let's talk about the social history. Let's talk about the personal history. Let's talk about the sexual history. Let's talk about the sexual life, something like that. Okay, you're not going to ask permission. If you ask permission, person might say no. Then like it will be very hard for you to convince him. Like okay, if you say that, okay, is it okay if I ask you about your sexual history? Person will simply say no. Now what you will do? It will be a very bad situation. You can't just force him, okay, no, no, I need sexual history. So if you need, then why did you ask me for permission? If you're asking me for a permission, I decline it. So better not ask for permission. You're just going to signpost. Let's talk about the sexual history. I need to ask you a few personal questions. In that situation, person might say, okay, no, I'm not comfortable with it, and at that time you can say, I'm sorry you feel that way, but these are all the questions that we ask to all of our patients to get a better understanding of the what is happening to you, something like that. Okay, the sexual practices in the sexual history. Again, please. Again, whatever I'm saying, it is just a general format. You will not get the time to ask each and every question to the patient. If the cases about the sexual history cases, they're not going to miss all these points. But if the case is not about the sexual history, they're not going to waste your time asking about this, are they sexually active with a partner, male or female. It doesn't have any relevance to the case. Patient is coming of a headache. Patient is coming coming with something, a vague problem that is not related to this STDs. Then why are you going to ask about the sexual practices? It will just waste your time. I'm not saying it is wrong to ask, but you have a very limited time. You have to cover the history taking, investigation, management plan, so you'll not get time. So be smart, guys. Like, mm, later on when you do the cases, I'll talk I'll talk about these things also. But just remember, yeah, whatever I'm saying today is just a general format for each topic. You are not going to ask all these questions to every cases. If you think the cases of STTs, which you'll obviously know after doing so many cases during your PLAB preparation, you don't have to take headache of that. You'll know as soon as you look at the cubicle, outside the cubicle, the description of the patient, you'll get a rough idea, okay, what the case is about. Okay, so yeah, I think you guys got my point. Okay, uh, 21 minutes. Okay, let's not just waste time. Okay, sexual practices. Okay, in the sexual practices, the question you are going to ask are you sexually active? Is your partner male or female? Very important. Okay. Do you practice safe sex? By this, what I mean is that do you use condoms while having sexual intercourse? Okay. So, what kind of sexual intercourse do you usually prefer, or do you usually practice? Like oral, vaginal, anal? Very very important question for the STDs. Okay, oral. Yeah. When was your last sexual intercourse? If the patient says that no, I haven't had sexual intercourse for a long period of time, or not recently, whenever you ask that, are you sexually active? And he says not at the moment, and at that time you can ask, when was your last sexual intercourse? Oh, it was just 3 days back, and the symptom started after the sexual intercourse, so it is somewhat relevant, right? Yeah, so another question would be, have you ever had sexual intercourse for casual purposes? This means multiple partners. Mm, So it is very common for the STDs. How many sexual partners have you had in the last 6 months? This is very, very important. Okay, last 6 months. Patient might say, no, I'm very loyal to my wife. I just have sexual intercourse with my with sexual intercourse with my wife for almost a month. And you can say, okay, so how many sexual partners have you had in the last 6 months? Oh, yes, doctor, I have like 3 or more partners in the last 6 months. So a sign or a risk factor for the sexually transmitted infections. Have you traveled abroad? Very, very important because with usually when they travel abroad, they might have indulged in the sexual intercourse, casual sexual intercourse. Did you have any sexual intercourse with anyone when you were abroad? You can ask these questions. About the relationship. Are you in a stable relationship? Are you married? Okay. These are very, very important questions whenever you think the patient is of the reproductive age group and patient is coming with low mood. The stable relationship and are you married or not? These are very important things to ask in a patient who is having a low mood or who is depressed, something like that. Okay. So previous infection and testing. Have you ever had a STI before? Very important question. It is somewhat similar to the past medical history for the sexual cases, sexual history cases. Have you ever been tested for STI such as SIV, chlamydia, or gonorrhea? You don't need to give examples. Just say most of the patients will understand what the STD, STI are. You can just elaborate the term sexually transmitted infections. Okay. Symptoms. Are you experiencing any discharge from your penis or vagina? So discharge. Any burning sensation when passing urine. Okay. Any ulcers or lumps around the genital area, syphilis. You know are you running temperature? So just fever. You don't have to use this typical words running temperature. You can simply just ask, are you having any fever? Okay, about the partner history. Is there any chance you could have any other partner? How many partners did you have on the past 6 months? So this is basically similar to the one which I talked about, in the above. Yeah. Did you have any sexual intercourse with anyone when you were abroad? And like there was one question. I don't know where it was. So like, how many sexual partners did you have in the last 6 months? Something like that. This is very similar to these questions. How many partners did you have in the past 6 months? It's more or less same. And symptoms in the partners. Is your partner also experiencing the same symptom as you are having? Something like that. Like discharge from the private parts, pain and lumps anywhere, because in the STIs you need to treat both the patient and their partners as well. Tracing contact. Tracing contact. It is very, very important. Okay. So whenever patient is, you see patient with a sign of STIs and STI, then you should like tell them that you should like inform the partner. If they don't, then contact tracing would be done, something like that. So okay, so this is very important. Did you have any sexual intercourse with your partner or wife after that? After okay, so example is patient going to the abroad or patient having casual sex with another partner, and after that, if he or she has sexual intercourse with their partner, then of course you need to contact. Yeah, you need to trace the contact and also treat the patient's wife or husband. Okay, so what kind of sexual intercourse did you have with your partner, or anal or vaginal? Did you have sexual intercourse with anyone else after that? Did you use did you practice safe kiss after while having sexual intercourse? Like, did you use condom or not? Something like that. Okay. Okay. Menstrual history. So yeah. Okay. So after finishing, so where were we? The maftosa. We talk about the present complaint, past medical history, personal history. Medication history is a little bit left. Okay, okay. So this comes on the personal history, the menstrual history. Okay, whenever you see a female of reproductive age group or any age group or which has been like patient with the dysfunctional uterine bleeding, abnormal uterine bleeding, you have to ask about the menstrual history. It comes under the personal history, similar to the sexual history, right? In the menstrual history. Again, guys, look at the cases. You are not going to ask every patient all these questions. Just select the patient. If you think menstrual history is important, spend time on it. So the question would be, when was your last menstrual period? Very, very important. Okay, for the pregnant ladies or ectopic pregnancy. Are your periods normally regular? Thyroid irregular. The thyroid problems patient might have irregular menstruation. Patient with using contraceptions, they might have irregular menstruation. How many days do you bleed for the menorrhagia cases? Long days of bleeding associated with menorrhagia anemia, identification anemia, right? How many days is your menstrual cycle? Regular or irregular? 28 days, 32 days. Do you pass any clots? Are your periods painful? Dysmenorrhea. Are your periods heavy? You know, menorrhagia. When was your last cervical smear done? The cervical screening test. Report to age group. After 25 years, you usually will do. If not done, advise her to have a cervical smear test. Okay. What were the results of your last cervical test? If she has done. Only if she had a previous cervical smear. If she didn't have a cervical smear, what is the point of asking the result of your last cervical smear? You'll just lose marks if you do these silly mistakes. Okay. So do you use any type of contraception? I already talked about the pills, the implants, or anything like that. Okay. And if so yes, then you have to ask which contraception are you using. Okay. So three P's are done. Now towards the maftosa. Oh my god, this video 28 minutes. Okay, I think we still have some time. Sorry for this long video. Medication history. So three P's are done. Present, past medical history, and personal history. Now coming towards the maftosa. The first in maftosa M is medication history. Are you taking any regular medications? Are you taking any over-the-counter medications? Are you on any type of contraception? So this can be in the contraception history or also in the medication history. Okay, and just be careful. These are for the females. Okay, for the reproductive age only. And the A stands for allergy history. This is very, very important in every case. In previous I said that we are not going to ask these things to every patient, but the medication history, the past medical history, and the allergy history, you are going to ask to each and every patient. What I used to do was I always used to ask medical history. like the history of hypertension, diabetes, or something like that. The medication history. Are you taking any regular medication that I should be aware of? Okay. And the allergy history. These three history you cannot miss in a history taking. These are very, very important. Okay. Past medical history, medication history, and regular medications. Allergy. Are you allergic to anything or any drugs? Okay, any medication? If yes, then always ask what happens when you take it. It might be simple rash, or patient might give a history of severe anaphylaxis, like difficulty in breathing, going to the hospital, using some IM medication, something like that. Okay, so as just very, very important. Next is family history. You are going to ask in the family history. Anyone in the family with similar conditions or problems? Anyone in the family with heart problems? Very, very important for sudden cardiac death. You know. High blood pressure, high blood sugar levels, asthma, thyroid problems, something like that. Travel history. Okay, so this is important for the sexually transmitted infection or for the endemic diseases like tuberculosis. Have you traveled abroad recently? If yes, where did you travel to? In which region? Um, because in the endemic regions or whenever they come to these Asian countries, uh, they might get, it's a very high chance of getting like tuberculosis or any traveler's diarrhea, something like that. Okay, occupational history, very, very important. What do you do for a living? Are you retired? Okay, and what did you used to do for a living? Okay, so I just remembered my one case. Yeah, this is very interesting. I have to tell you guys. Occupational history. In my previous video, what I told you, like I think in my first or second video, what I told was, if you get confused, like if you don't, even after practicing like thousands of cases, sometimes you'll get a new case in the GMC or totally unaware of the cases, or sometimes you might even forget what the case is about. You will have no idea what this patient has the problem with, or what is the disease about that. So the patient, what happened was the patient was saying he's not feeling of good himself. The case was little bit of kind of a depression. In the depression cases, there is usually some background history, like what happened. And when I asked him, the there was depression, but I couldn't figure out what was the cause. So in order to counsel the patient, I must know what was the cause for the depression, whether it was a fight, whether it was a relationship problem, so that I can talk to him about that in my final 2 minutes of the consultation, right? In the management part. So what happened was this patient has nothing. Medication history was clean. Uh, he had a stable relationship, something like that. No any fight among the friends, something like that. So I don't know, like, so I was pretty much blank at that moment. So what I did, what I had prepared in my mind was, as soon as I get confused in the cases, I have to utilize my time, like 10 minutes time. So what I used to do was I used to always give emphasis on my history taking. Forget everything else, just do one by one, PLAB. So what I did was, okay, I did everything like travel history, something like that. I was just wasting my time. I might get a few points deducted for asking unnecessary questions. But what strangely what happened to me when I came to occupational history in my mind, Pibaf Tosa, when I reached to the O part, occupational history, and I said, okay, what do you do for a living? He says, yes, doctor, I'm retired now. And what I was, so here it is not written, but after whenever person says, I'm retired, then you are going to ask the follow-up question. Okay, so how are you enjoying your retired life, or how are you feeling after you are getting your retirement? So that was the follow-up question. It was just in my mind, after practicing so many cases. It's just a follow-up question. Okay, I told him, okay, what do you do for a living? He said, no, doctor, I'm retired. Okay, so are you enjoying your retired life? And he says, no, doctor, I miss my work or something like that. And he talked and he gave the history there. So what happened was he used to enjoy I think he used to work as I forgot, like it was 2, 3 years back. What he told me, okay, I'll just give an example. He just told me that he was in some kind of occupation, maybe some industry or industrial worker or carpenter or I don't know, in his office. And what happened was he used to miss his friends. He used to miss his work. He's not. he's finding his retirement life is very lonely. So that's why he was getting depression. He was feeling having low mood, and at that time I okay now I got this case. So it was of a depression, but due to the retired life. So he just need to like have a cognitive behavioral therapy, and like he need to have some engagement in his diamond library newspaper, have some hobby, invest some time with his hobby, whatever he feels good. And if that doesn't work, then we also have medication for this kind of things. So we'll first try with the behavioral approach, and it just went smooth after that. It was very good session for me, you know. So this was just a short example. Sorry for taking up your time, but this was very important. Okay. So yeah, occupation history, and here what it is not written is that I'll just write. Are you enjoying your retire? Oh, okay. So are you enjoying your retired life? Or you can also say, okay. So how is your retirement life going on? You can ask going on these questions. Okay, follow-up questions whenever patient says I'm retired. Okay, so social history. Okay, so who do you live with? Do you live in a house or a bungalow? Do you work independently? This is usually for elderly patients or patients with disabilities. Is there anything that is causing you stress in your life? Are you married? Do you have any children? Do you smoke? Yes. You remember, guys, I told about the smoking alcohol thing in the social history. So even if you forget all these questions, in the social history, you are always going to ask each and every cases the smoke and alcohol, because this is very common. Smoking leading to various number of diseases. Drinking, same thing. And whenever the patient say yes, I do smoke, and you ask about the um, back year, or how much does he drink or does he smoke. If it is exceeding the limit, then you are then and there you are just going to advise. Have you ever thought of quitting smoking? Have you ever thought of stopping the alcohol? We have some services available for you if you like to talk about it. And just you're not going to convert it into the smoking cessation scenario, but just then and there just give a sort of advice. If you ever feel like stop smoking, we are here to help you with that. Is that okay? The person say yes, okay, and move on with the question. Okay. So smoke and drinking comes under the social history. And you might be thinking, okay, so why this is important? Who do you live with? Do you live in a house or bungalow? Okay. Do you work independently? Independently. This is for the elderly person. It is already mentioned here. Or person with the disabilities to know his lifestyle. Okay. Whenever a person is discharged, you have to know about his condition. House or a bungalow. In a house there are steps or stairs. So you have to think in the perspective of the occupational health, whether this case need to be deferred or not, because patient with a knee injury or knee pain, when you discharge home, he might have some trouble going to the upstairs and downstairs. So you might have to involve occupational health to build a separate bathroom for in the ground floor or something like that. Sometimes NS also build some escalator to move through the storage building, something like that. So in that cases, these are important. So each and every question has some relevancy, but these are based on the cases. The person is having a headache, and you're not going to ask him about whether he lives in a house or a bungalow. So this is kind of absurd. But the patient is having a knee pain, and you're talking about the knee pain, osteoarthritis, and at that time, social history is important. House or a bungalow, how many stairs does it have? Where do you live? Where is the bathroom? At that time, this is important because you might have to involve the occupational health. Okay, so every question has some connection to the cases. Okay, so you have to be smart. You have to practice the cases, and you have to ask the relevant question. Okay, and and my mantra or formula is that if you get confused, just go with the history. Just focus your history. You'll get some marks there. Okay, you might some pass even you don't reach to the management part, but you might pass because you are taking digital history and trying to figure what is going out. If you don't do anything, focus on the maftosa history. Okay, and last part is anything else. I have talked about this multiple times. When you finish your consultation, always ask about the expectation or anything else. Like in the history also, in history taking also, like in history of present illness also, or in your history, when you finish your history taking, before going to the investigation and management, you can say, okay, is there anything else you'd like to tell me about your condition? Patient might say, okay, apart from this, I'm also having lack of sleep. Apart from this, I'm also having some job problem, or I'm not um, coping with job stress, something like that. You might add some one or two things. Okay. So yeah, anything else? This you are going to ask these questions after taking the full history of presenting of them. Okay, so it's really late for me, guys, and I think this video was helpful for you. And please, if you find this my video good, at least give a like, comment, and subscribe, and share it among your friends. This will motivate me to make more videos. So I don't know, like tomorrow maybe I'm going to talk about I don't know, like diagnosis. I think these are some short short notes, I think. BMI, in which cases you're talking about the BMI, tiredness, dizziness. Okay. Yeah, I think I talked about the telephone yesterday. My yesterday's video, telephone consultation, how you're going to start. Intro is finished. History taking finished. Starting a station, introduction finished. Flow of consultation. Okay, so this is all about today. See you tomorrow. And yeah, sorry about this video got quite long. Hope you guys enjoy and prepare well for the exam. Subscribe and share it among your friends. I'll try to uh, complete complete my try to complete my this lab to note by uploading daily. But during my work, I'm quite busy. I will try to upload daily, but I might miss 1 or 2 days uh, due to my work schedule. So yeah, see you guys in the next video. Uh, some spell mistake. Talent. Okay. Okay. So this is it. Thank you. Bye bye, guys.